My name is Diane Crecelius. I'm a physical therapist and an owner of ABC Pediatric Therapy in the southwest corner of Ohio. So if you already know how to manage percent of arrival and you're still low, it has to do with people not valuing your appointments enough to schedule around them. That's how you have to train up your team. Now, not every single cancel, but as a whole, as a group, when you look at the number, the volume of cancels or no-shows you have, somebody didn't value that appointment enough to go. Think of it when, oh my gosh, you need your hair. If you get your hair colored, oh my gosh, I need to get my hair colored. I mean, I just had it done Friday, so I didn't, but you better believe I was not going to forget that appointment on Friday because it was so important to me to get rid of that skunk mark. I had to get to that appointment. See, I made Nancy laugh. That's funny. But anyway, you have to make sure, I get it, our appointments happen every single week, sometimes multiple times a week. They still have to be so valued that they schedule around them and they don't forget about them. If you see somebody 3 times a week and they're only coming in 2 pretty consistently, 3 times a week is too much on your schedule. Cut them back to 2 times a week. You want those appointments valued. You just don't want a filler. And you need to find another patient that's going to value the appointments to get in there. You have to really measure percent of arrival. You need to understand the statistic. You need to understand what increases it and what decreases it and how you can affect it. And you have to have systems in place to measure your cancel reasons, measure your no-show reasons. If somebody no-shows, you need to understand why. You need to get on the phone, you need to understand why, and you need to train that up. And you need to do it in a very professional but firm way that makes them understand that is not appropriate. Okay, so get it trained up in a way that you decrease the frequency. It doesn't happen again, right? And again, I'm not saying grandma had a heart attack. The first thing they should think of is calling you. If the house is on fire, call me before you get the kids out, right? Don't be dramatic with my example, but be firm. Look, because most of your no-shows are not because there was a fire in the house or not because grandma had a heart attack, right? They just forgot. And that's what you need to handle. Okay, so be real here. So why is percent of arrival important? Okay, so that's what I was saying. It speaks to quality of care. It speaks to people valuing you and your service. It speaks to your ability to communicate progress during your treatment sessions that are meeting the goals that the parent wants to meet. So what happens sometimes as a therapist, I'm a physical therapist, what happens sometimes is, and I'll give you a PT goal, sorry, that's what I'm familiar with, but you get a mom that comes in and the child is 15 months old, not yet sitting, and they say, I really want them to walk. Well, I'm not gonna write a walking goal for a 15-month-old not yet sitting, right? But I need the parent to understand that. I need the parent to understand the why behind. First, they need to sit. Then they need to transition in and out of sit. Then they need to pull to stand. Then they need to cruise. Then they need to walk with a walking toy. And then I can help them walk, right? So I'm going to get your child to walk. We are going to do it together. And I can't wait to team up with you to make this happen. But I need you to understand that there's a process. So the first goal we're going to write is sitting. And I'll probably write this down for them, right? And to show them, here's the process. And then when we meet these other 5 goals, then we're going to write the walking goal. Does that make sense to you? And make sure the parent understands why you're not working on their goal. You are, but it's not written as a walking goal because you have to learn to sit before you can walk, right? So it's that communication level that you need to get your therapist so well trained to speak the parent's language. Parent came in, they want their child to walk. They're not even working on walking. All they work on is her and sitting. We can do that at home. I want her to walk. They don't understand. Bring your level of communication to the parent's understanding. So that communication level, teaching your therapist how to communicate effectively, because I think it makes or breaks relationships. And whether it's your marriage, your relationship with your significant other, your relationship with your teammates, your relationship with parents, you need to have strong communication skills, and it will make or break these relationships.